Do you mind taking questions from people?
No.
That'll be cool. Karyn, Micah. Oh, I can tag Micah projects. Alright, are you good, Myron?
Just 1 second. Can I get a mic test?
Testing.
Mic check.
Testing.
Oh, good. That's it.
Hello. We'll see if we get some people. Once we get a couple of people coming in, we'll get started. We have one viewer. That'll do.
That's enough.
Yeah, exactly. All right. Hey, everybody. We've got Karyn. Karyn is the CEO of Micah Projects. Bo is the president of Murray Street. They all know that. And me, Paul. We also have Byron here. I'm not sure if he wants to be everyone to see him, but bad luck. They have now. We're really excited to have Karyn joining us tonight. I think I was very pleased when you said you'd chat with us, especially at 7 o'clock on a Saturday night. Much appreciated. Did you work all day today as well?
A bit.
Yeah, always, never ends. Why don't, for some people that maybe don't know a bit of the history of Micah Projects and what you do and what your role is at Micah, you're the CEO, but you see the day-to-day operations, or what do you do?
I'm around. There's a lot of things you've got to do as CEO, but it includes working pretty closely with the teams that are doing outreach or the hub or our family and children's teams. Not all of Micah's work is homelessness related, but just about every program is struggling with people who are in housing stress, and many more probably are facing housing issues than in the past, like our domestic violence team, our young mothers. We've actually got a young mothers program in Caboolture and Redcliffe and Brisbane, between the three. So we see housing and homelessness from a few different angles.
And I thought traditionally you were kind of in the Brisbane City Council area, but I know you've got a women's hub up at Caboolture now. Yeah.
Well, we first thing we did in Caboolture was Young Mothers for Young Women, because there was a tender process for supporting, and we thought replicating what we do in Brisbane was a good idea. We work closely with the Caboolture Hospital, and we work with women under 20, because Caboolture's got one of the highest rates of teenage pregnancy in Australia. And then that's just grown to going to Redcliffe, and then when the tender for the women's hub came out, we put in and were successful. So
yeah, cool.
And they're doing a fair bit of outreach and working with women in Caboolture who are rough sleeping. So they've been trying to integrate that response as we go.
And I'm sure most people know who you are, but what's your how long have you been at the helm of Micah, and what's your background before you were with Micah?
Well, I started out as a nurse trained, and then did youth work in Rockhampton, mainly street work in the late 70s, early 80s, when the institution, like orphanages, were closing and institutional care was beginning to be looked at as evolving into people living in the community. But Rocky had a fairly big prison, so we had a lot of work there with people coming out of prison, a lot of young people. There'd been 5 orphanages in Rocky, so the street homelessness, and people were pretty transient in those days, because you didn't have to have a fixed address for Centrelink.
Right.
You could register when you went, but then when that changed, it changed how transient people were, and was fairly involved in the domestic violence refuge up there. But it was all poverty, and in those days you could house people,
yeah,
you could not easily, but you could get a group of people together, group of young people, and on their benefits you could pay the rent, whereas that's not the case anymore. So in some ways we didn't it was just automatic that our job was to really want people to get housed. But you had all the same interruptions of prison or sickness or a lot of addiction in
Yeah.
those days. And so people with a disability were beginning to come. Ozcare or Vinnie's back then, you know, that was mainly a middle-aged man who had alcohol issues, who had successful careers. Like you didn't and things that, you know, the adversity of alcoholism and poverty and marriage split-ups, family breakdown was probably the dominant issue in homelessness then. And then as orphanages closed and a lot of kids from orphanages ended up on the street after foster care when they turned 16. So you had that exiting from care issue that we've still got, but it was just on a large scale because so many institutions were closing.
Yeah, right. And we still, so you said that there was a lot of sort of alcoholism and addiction issues back then. Are we still grappling with that issues
of course,
now?
well, you know, you see it.
Do you think it's gotten worse?
Well, of course, the complexity of drug use is much more polydrugs. Like you used to have people who were injectors and people that were alcohol, and the two didn't mix. And you know, in Brisbane when we first started, we were very involved in Musgrave Park when we were down at St Mary's House. Around public intoxication was a huge issue. Lots of issues about police, you know, engagement with the police wasn't great. We had a death with Daniel Yolkin. So, you know, there was a lot of things going on in West End back then and South Brisbane.
Yeah.
And the river was a big divide, like people on one side of the river or the other side, and that's nowhere near as an issue as it used to be.
But now we're grappling with housing crisis and cost of living crisis, and like you said, back then it was easier to get people or to find affordable accommodation. I guess affordable accommodation is the biggest issue.
Back then the safety net was just starting, like we just, you know, single parent benefit, New Start, all these safety nets that were there for people that were never enough, but they at least worked to a point. Now our safety net is almost broken, like every aspect of our safety net of income, healthcare, family support, you know, in healthcare there's the mental health, disability, addiction, like there's not a safety net for people anymore. And I think that COVID really showed that.
Yeah.
Like it showed that it was like reflecting back to us just how broken our systems are when it comes to equity and getting people with different needs getting the same services they deserve as people who can utilise and be valued in a mainstream system.
And I think for me, like, you know, I had someone the other day that said, you know, I'll take anything. I'll go into a boarding house, and I got a list from another service provider of all these boarding houses, and I was calling and they were all full. But even the ones that are, well, any of them, like, they're starting at like $250 a week.
Oh yeah, it's ridiculous. But we've had this crisis with boarding houses before, like after the fire in Childers and the regulations, we lost hundreds of beds in Brisbane, and other communities would have as well. So we had 365 people on the street in a 7-kilometre distance in 2010.
Yeah, right.
When we went out and counted and interviewed most of them. And we were able to then, you know, the data we had was useful to say this is the scale of the problem, and other forms of data from other services, because that was a big collaborative exercise. It wasn't just us. But we learnt the process from the US, and Roseanne Haggerty came out and she put a challenge to us to try and house the 50 most vulnerable people on the street. And we used a tool that has evolved now into, it's called the AVID, but it was just an index then. And it was based on the, you know, the conditions in which people died on the street, and how to get a quick understanding of people's housing and homelessness history, their healthcare needs, their daily living or personal support needs and, employment if they were able to get a job. And institutional care, so prison background, in and out of hospital with ED. So we did that we had heaps of volunteers came, went out at 4 o'clock every morning for 3 mornings to try and interview as many people as we could. We went as far as Redcliffe. And because we knew there was always this movement between Redcliffe and the city. But it was mainly, there were about 360 just in the city.
Yeah, right.
So after that, the difference was that there was the economic stimulus. Also, Peter Beattie at the time put a lot of money into replacing the beds, like single units, studio units, knowing that all those boarding houses, but you could build quickly and it wasn't as expensive. So
Yeah, that's the double whammy now,
that's
right?
what's happening now. Well, also a lot of inaction in between. So, we've got to get through that. And if it's the cost to build, it's the cost to build. You just have
You
to
just
build
got to
it.
build it, right? Yeah, I think, and I mean, you probably know better than definitely either of us, but anyone, is there anything in the pipeline at the moment in terms of,
I wouldn't know.
yeah, right,
I mean, there's what you see in the housing plan.
yeah,
And the housing plan is a plan for building houses. It doesn't quite match the need for the type of housing that we need for people who are actually homeless right now. Like, we know we need, probably 300 supportive housing units for individuals, and we'd need just as many for families probably.
and when you
across
say that,
South
is
Australia.
that like that common ground model, or is it
Yeah.
more the
That's
brick
supportive
housing, or that, yeah, or they're the same, would you say, brick housing and,
No, community housing providers are managing social housing.
Yeah.
They may have some supportive housing. Redcliffe, I think, Brick do. It's transitional though, the 16 units down there.
yeah, right,
Brisbane Common Ground was an intentional build to build supportive housing to get the 50 most vulnerable people off the street.
right, so it was from
And-
that thing that you said, that the
Yeah,
challenge that you had,
And we used that data to get the 50 of, there were more than 50, but 50
Yeah.
of them. And while it was being built, we had placed people in housing, the other new housing, so we sort of knew pretty well who couldn't cope with just outreach support. And we went for the most the ill people, because the MARTA had donated the money to have a nurse and were working with us around healthcare. And that has proved really successful.
yeah, I think common ground is it's like the gold standard, right, for supportive housing?
Well, it should be the normal standard.
Well,
Like,
yeah.
it's basically just housing like everyone else in South Brisbane.
Yeah,
Small units, they're not luxurious. It would cost the same money that it costs to build a 20-pack or 50 units in suburbs at the time. The density absorbed the cost. It was economic stimulus money because of the global economic, whatever it was, crisis,
financial
I forget
crisis,
now.
yeah,
So, it was about creating jobs, and to go high meant you created a lot of jobs. So
yeah,
that's not the environment we're in now, unfortunately. But we do have to really convince governments that building dedicated supportive housing for the people that are in motels and who really need it, both families and individuals, is going to save money in the long run,
Well,
and
that's
is
what
going
I
to
was-
give people a quality of life.
yeah, that's what I was gonna bring up, because I printed out the Deloitte, report that Common Ground did. I went to a webinar just a couple of days ago, and the, Sue from, Common Ground was talking, and I was blown away. I was like, man, I wish I knew these figures before I went on the ABC the other night, because I did say on the radio,
Well, the 13,100 or something it was the savings per 40 tenants who agreed to have their actual administrative data, so it wasn't a guess. Like,
Yeah, wow.
Cameron was able to access the utilisations of hospitals, prisons, homeless services, and compare the year they were homeless, the cost of the year they were homeless, to the cost of 1 year in supportive housing, with all of the costs, not the capital, but the operating
Yes.
costs for a year. Now, that doesn't mean that you get a savings every year of 13,000 per person. because everyone's life changes, and
Yes.
already in the first year, people weren't going to the watch house. They were ED presentations reduced. Of course, it was only unnecessary presentations. There were still people that were so sick where they needed to present.
Yeah.
And people weren't going to prison for as long. So it's demonstrated that, and it's been demonstrated around the world. It's one of the most evidence-based models. It's getting smashed in the US because it didn't solve homelessness because, well, it wasn't at the scale that it needed to be. But probably some of the challenges we've got is how do we make housing work when our mental health system's broken, or there's no addiction services for people, or there's no disability support.
Because you've got to do that whole wraparound, right?
You really need all these systems to be focused on a person-centered approach that gives people a range of things that they need, and if you do that on scale, there's some value to it. But you need small places, medium places. Every community, it's got to be place-based, because your planning rules at Moreton, for example, are different to Brisbane, so I don't know what density you could go, but there's certainly value in having some high density.
And if we know, like if we've seen that it works overseas and we know it works here in Brisbane with Common Ground,
And
why
Sydney and Melbourne and
why is it
Adelaide
not-
and Perth.
why are they not doing it though? Why?
Well, unfortunately, it's got a bad rap as being too expensive, and I'm not quite sure what is too expensive when it's compared, and hopefully that you can reduce. We've got a project, what we need is a system, you need a few hundred units of accommodation, so that sometimes people might need to move between them, because of conflicts and a learning process, like you might get evicted, but you can learn from that if you've then got another option. We need some boarding house styles, because there are people, every time there's a boarding house closure, the same message comes: we want to be connected to people, we don't want to be in a studio by ourselves, we don't want to have overcrowded units and then get evicted. So you've got to really look at who's the tenant group we want to build for, and then design it around that. And then it's then working out what's the community, what does it need to be a community, what do individuals need. Like, they don't have to do everything together, it's not an institution. But what are the range of options you give people, and the community can be involved then unfortunately we have more models of community being involved when people are homeless than we do when people are housed, so.
Let me have a look. There's been a bunch of comments coming through, so we'll see if anyone's got any questions. This weekend, watching your lives has been really informative. That's awesome. I'm housed but extremely isolated. That's something we hear all the time.
Well,
right?
success, if you want to use the word success, I mean, I don't know whether it's success or whether it's that people have a quality of life requires healthcare and well-being. So whatever people need for their health. I mean, there's a great article that talks about the three homes: the home within, the unit being the building, and the community. And you would add to that culture as well, that people are connected somehow. We know some people can't be reconnected with family, but they can be supported to have friendships, and those three things really have to come together to give someone the opportunity to even sustain a tenancy.
And Micah does a lot of work with people, and you were saying that you get a lot of phone calls from people that have gone into housing but continue to access your services, because that is so important, right? And
we have
do you do
a
a lot of
team,
projects?
we have a couple of teams that work with people in housing, like families team, and
so how do you combat isolation when people have moved in?
well, you've got to create, we still do a community meal once a week, and do it by invitation, because you can get overwhelmed with everybody coming to everything. I mean, one of the things we learned when we went overseas once was that neighbourhoods were giving people invitations by neighbourhood to come to a meal and get to know people in the neighbourhood, rather than everyone just coming to one big meal in Brisbane and going to a different place every night. So you've got to intentionally look at how you can create community with the people that we're supporting, so they can have a sort of, some people know naturally how to connect in with something.
People with alcohol problems try to get help. They want to get better, but you have to go through so many hoops to get help. I've just put myself in rehab and it cost me $1,500 a fortnight. Who has that money? Feels like government don't care and want to help with prices like that to get help. No wonder we have problems. Thoughts?
Well, it's true.
Yeah.
But, you know, we don't do much to support people when they're pre-contemplative. In fact, I think people with addictions are the most judged people in a lot of systems.
100%.
And I think that, you know, you've still got to offer people, you know better than me, offer people something when they're pre-contemplative so that when they can then think about what they want to do. You know, certainly during COVID, we saw the benefit of having a couple of nurses doing case management with people and then working out with them, because sometimes people don't understand what's contributing to their poor health. So when people get to sort of talk about their health and have health assessments regularly, then they can sort of start thinking about, well, what am I taking? How is it affecting me? And then you've got to wait to rehab, but we need much more home-based care, and we need to be not so harsh on, you've got to want to do all this before you get a service. I mean, it's all got to be a lot more smoother for people than just.
So just touching on that, I've noticed a bit of a trend across Moreton Bay and even in Brisbane CBD that someone who you know, is clean and sober seems to be more likely to get accommodation, whether it's temporary or something through Department of Housing, a lot faster than somebody who's still dealing with addiction.
It's possible because they're seen as housing ready.
Right, okay.
And that's where you need supportive housing, which is more about anyone's housing ready. They just need the support to make it work, to understand what a tenancy is, to understand what being a good neighbour is. People have been living very different lifestyles and these things don't come naturally. Some people have disabilities, brain injuries, and it takes a while to readjust. I mean, we had people who have gone and slept on their balcony for 6 months because they haven't felt comfortable sleeping on a bed. And sometimes they go out and they want to be around people and watch people, so you just keep working with them and bringing them back. And over time it changes, but it doesn't change rapidly for everybody. Other people, they can't wait to be in and they won't be leaving. Even people with addictions, there's plenty of people with addictions who are sustaining their housing.
I have a couple of gentlemen that I know of that recently got housed through Department of Housing, and they were long-term homeless individuals. I know that they've gone into this accommodation with no support system, so at the moment they appear to be doing okay, but I have great concerns as to whether or not they'll be able to maintain that tenancy moving forward.
Some people, we've noticed the big risk is 12 to 18 months. And, you know, sometimes that's because some neighbourhood conflicts might occur and they haven't been mediated or, you know, supported to just work it out. And it can be a really small thing sometimes. So, I think people need support
and with
wherever you can get it.
This 3 strikes and you're out policy that's coming now for someone that's experienced long-term homelessness, and you know, they may rub the neighbours up the wrong way. You know, I guess for me, like I kind of think it could be unfair and it could be used against particular people.
Well,
as
different people.
To weaponise almost, you know.
Well, and also they're all predisposed to it happening. Like Cameron Purcell did a great project on that the last time it was in, which really showed people with mental illness and addictions were proportionately the ones that got put out. I think that we've got to do everything we can to problem solve with each person and with the community in housing. It's not one size fits all, whereas our system's very much one size fits all, and we need to break that down, because we say as a community everyone's got a human right to housing. We say that we don't want institutions. Well, if you don't want institutions, you've got to have something. Like, we have a responsibility for people to live with a sense of justice as much as they do with care, so that their rights can be protected. well, we've got to make that real. It can't just be something that we talk about. We've actually got to work it out.
Yeah, how
And
do you
what does
actually
that
do it?
mean every day?
And is that, could that be done by case managing
Well, case,
individuals, or?
I think case management's a very overused term when it comes to the poor, because sometimes I feel that, you know, it's a housing crisis until we deal with the poor, and then it's about the behaviour management plan. And people may need that, but I'm not knocking it completely, but I do think we can overstate it. Because sometimes people just need basic needs to be supported on a regular basis, which is what we all do. We've all got a network of people that help us do what we do, meet our responsibilities as parents or friends or tenants or whatever. We're not just living in a vacuum ourselves, and I think we can take that for granted. And the general community isn't aware of just how much and how hard that is, and how do we actually bring some sense of community, as well as where you have to have paid workers doing it. You definitely, I think we need to change our model of case management a bit. It's not like this dream that someone has a goal, they meet the goal and then you go and then they're happy. People need day-to-day support. They're never going to be independent, and we sort of have the goal that everyone who's getting a government funded service will be self-reliant at some time, whereas nobody can be self-reliant and have a quality of life and be able to meet whatever personal needs they've got around capacity or intellectual ability or understanding of what they've got to do to have good health or not have good health, or, you know, to be a good tenant. There's heaps of things, you know. So
I
you've
say that
got to
often,
build that up.
I see many people that I say they're going to need support for the rest of their life, and we should be okay with that as a society. And I think some people just aren't, which is disappointing.
Well, I think if people understood the people we were talking about, and it's not all people with mental illness and addiction, and even if it was, those are experiences that have happened to them, and people have made choices. It doesn't mean that forever they're going to have to live with that choice.
Exactly.
And people can be rehabilitated, if people want to use that word. People can, and we can put a lot of emphasis on people have to change. Well, people have to be well and healthy and make choices as they go. We can't prescribe those for them. People do the work themselves, but we don't do it.
They just need to be supported, and
Well, they've got to have the resources around them to make it work, and for some people those aren't daily. I mean, you've seen the people on the street. Our mental health system's completely not adequate to meet the needs, and it's a moral failure of all of us in a society to have so many people with mental illness living on the street, because they somehow are not considered compliant. The very fact you've got a mental illness is why you can't be compliant.
exactly.
Like it's
Alright,
sort of a
let me have a look.
catch-22.
Let me have a look and see. Is there help for isolated women like myself? I think this is, is there help for isolated women like myself that have been through lifetime homelessness, severe domestic violence, only just been housed in a roach infested place, but is all you can get, problems don't end?
Well, I think people are trapped. I think that's the reality that we're facing. They're trapped by violence. A lot of them return to violence because they can't find somewhere safe to be. A lot of people are trying their hardest to get out of a situation, to have something better, but the stepping stones and the bridges aren't there for them to move forward at the scale that they need to be. Like, we don't have very many early intervention services to support families early. We wait until it's all crumbling and then children are removed. The disability NDIS has left a huge hole in people who used to get block funded services, and some of them were beginning to do really well, but they can't manage even the assessment process to get onto NDIS. Hospitals are struggling. The health system doesn't want to do long-term support, but you've got to have a community that does long-term support, and you need to fund and invest in the community to do it. I don't think we've even tapped the creative ways that we could do that in the community yet.
I'm struggling with 2 boys being 3 years homeless. It's crap. Back problems, paying all my pay doesn't rent. What else we got?
There's a lot of people that are supporting family members who are homeless and you know, really taking that responsibility serious, and we get calls often and supporting people to try and make it so they don't get worse, or and some people are so desperate and ring to see if their son's in prison or what's happened. And
So being a Kiwi, what support is there for New Zealanders that become homeless here at the moment, and that they can't access social services, or if they can?
You know the answer.
Yeah, it's pretty tough.
Yeah, the income is an issue.
Yeah.
Since the reciprocal income, people on parenting with children just get the parenting component. You know, look, I don't understand why that ever happened. Because, you know, people are moving to and from New Zealand all the time, but it is an issue with visas, and it's an issue, you know, whether it's homelessness, domestic violence. But yeah, we can't just leave people. Papua New Guinea, we're having a lot of women come from. And I suppose we put people through the hoops where they've got to prove that they're worthy of a service, rather than really say, we can help. We just need to problem solve with you how. Like, we're not gonna, there's not endless buckets of money. We've got to work with what we've got, and how can we manoeuvre that, but we've got to recognise those structural barriers. It's not their fault.
No.
They're not getting an income from.
Yeah, like for instance, I guess, you know, if I was to become homeless again, you know, a lot of people say, oh, just go back to New Zealand. But for someone like myself who has 3 kids over here, you know, Kane's 20, Zion's 17, and my youngest is 7, going back,
Yeah, it's terrible.
it's not an option, and it's the same for a lot of people. You know, we know
I
a
met a
few
young
Kiwis
woman
out
when
there.
I was in New Zealand with a service that we were working together on supportive housing, and I went to one of their programs, and there was a young woman from New Zealand, had grown up in Australia, had had a child, and had been involved in a robbery, not as the key, like quite peripheral actually, but she got deported under that, and she has to wait 5 years, or she could argue, apparently, like, can they barter, can they put in an application to try and come back earlier? There's sort of all these rules anyway, and so she was waiting 5 years before she could come back to live in Ipswich, where her whole family is.
Yeah,
It's
wow.
disgraceful.
So we don't understand the impact of trauma of these policies, like policies that are set like this in order to curtail investment also can do more harm. So, and the trauma that people go through family separation, whether it's by child safety or whether it's by deportation in that case, you know, it has an impact on people's life forever. And then when people then are coming, we've got people in family homelessness who haven't been housed since they were children themselves.
Yeah. Joanne says, if we can build studio apartments for student accommodation, then why can't we build studio units for singles, couples who are homeless people, and build houses for homeless families? I guess it's the investment and
Well, the money is certainly, well, first of all, the plans are too long, like in the 2040, I'll be dead. I mean, it's too far away.
Yeah.
I mean, and so that doesn't give any hope, you know, so it's great what is being built. And, you know, I think you take to celebrate everything that's good, but not everything is good for everyone. Like we're not building enough. We're not building 200 family homes in Brisbane right now.
Are we at a place where we need to just build like cabins or emergency style?
I think we just got to get on and build the houses and get the land, and we've just had, you know, Wollongabba and them no longer have to include social housing in the developments. I think that's a great loss to Brisbane. I don't know what it's like at Moreton with the planning rules, that everyone's in an Olympic frenzy, but
Yeah.
we've got to remember that, everyone lives in this community, not just people who are going to participate in the Olympics. So we've got to make sure we include the most vulnerable, and that they're not going to be, I know lots of people go back to prison, if they've got outstanding warrants, everyone's actively looking for them, and then they'll be out of the way. There'll be no motels to put people in
Yeah.
because people are already in them.
So when will we start to see the effects? Are we already seeing the effects of the Olympics, or is it
Well, I
going to
suppose the market is, who knows, I'm not an economist,
be? Yeah.
but I mean, clearly house prices are up, rents up. We see people every day who have been successfully housed for 7 or 10 years, and it's only income that is stopping them from staying there.
Mm.
So the market rent increases are just too high. They happen too frequent, or they happen once a year, but people's incomes aren't going up.
No, exactly.
So I think that, it's a market issue and a structural issue. It's not actually a personal issue.
And fast forwarding on, when we look at the, the motel type accommodation that we're putting people into now, and although the way I see it is it's all we've got at the moment, but, with the Olympics coming up, those motels are probably going to be required back, which means a lot of these people are going to be on the street. Like, it's not a long-term solution.
Well, homelessness is definitely going to increase.
Yeah.
There was a great saying by someone who came out here from the States with training, who said, people who are homeless live in poverty, but homelessness is a result of prosperity.
Mm.
Yeah.
Like, homelessness is because all the profits are going up, land's going up, units are going up, and we're not actively intervening on the scale that we need to.
Yeah.
And we know the scale, it's not for want of knowing.
Common Ground, very good supported program, needs to be replicated. Yep, great organisation. I was an organiser with the ASU years ago, amazing mob doing great work. You guys all have a lot in common. Do you know the ASU?
Yeah.
Mm.
The Australian Services Union.
Is that what that is? Yeah.
Yeah.
Woohoo Micah.
It's not rocket science. I mean,
This woman
it's
has
just-
extensive knowledge, much admiration. Has the roadmap been lost since the change of government?
Now the same, they basically, the ALP and LNP have the same plan. They both agreed. The LNP said they would cover that plan, but it's changing as we go.
Right.
And it's always been, everyone's always said it needs to happen quicker, but we need these dedicated supportive housing projects, and we've got to do that around the need that we see in the community to prevent families being split up, to prevent people spending a lot of time in prison, to prevent people using acute care for their primary health care needs. Like,
Yes.
there's plenty of things that people know work. It's just a political will.
Yep.
And obviously all these planning and what are the barriers to building quickly and the cost, those barriers they can silence people and they can just give people no hope. But I don't think we should stop saying we want it.
Yeah. Micah projects really are the greatest people. They would help me with my bills when I was single mum, and they gave me a hotel room when I was homeless. I'm really so grateful for them. That's nice. I helped a lady move into HC in Chermside. The first night she was in such shock having her home. I had to comfort her with talk to make her sleep. That's nice. I'll see if there's any questions. In regards to 3 strikes and you're out, what about putting people into rehabilitation in the community? How about going through a behaviour program like the Triple P parenting?
I guess you can only help those that really want to help themselves. when it
Well, if
comes to
people
those
want to
things.
do it, by all means pay for it, because they won't be able to afford it. Or there are some free programs. But people generally, if you're living with the stigma of homeless and the stigma of abuse and trauma from like from a child to an adult, going to some of those programs is pretty intimidating. Like, people feel like they're not worthy of it, or they're not. And we know that's not true, but that's how they feel, because they feel everyone else in the room's got their shit together, sort of, is how it was put to me just recently. But it's something that you've got to, I think we need new models of where we're supporting people in a much more routine way.
Someone says you need money to get help. People look at us, addicts, homelessness, and go, "You're such a waste," and then say, "I can't help." If you can't help yourself, yet you're asking for help, then you go, "So no help." Mentality fucks with your head, and doubt, support, and community mindset turns to everybody go get a drink to
I
get through
think
the
that's
day.
the trauma we put people in, and that's what we shouldn't be doing.
Mm.
Like, to make people, for people to have to live in that whirlwind without being understood, we need to be much better informed and trained around that something has happened to people. It's not always what they did.
Yeah.
Like, there have been significant events in people's lives that most of us wouldn't be able to, see our way through,
Yeah.
much less. We could be in exactly the same position very easily. And we should really recognise that, like, for a while there, people did understand that you might be only 2 paychecks away from being homeless. You're also just maybe one adverse event that's going to affect you and your family that could change things dramatically, depending on what it is,
100%.
what resources you've got to manage it. We've had women come in with children that are dying, that they've got to have, or someone with the heart. Once we met a woman who had a child who was so blue in the car, I thought, what on earth's happening? And talked to her, and she was booked in for heart surgery for that child and got cancelled. And she had to wait a week, and that she was going to be living in a car. Like, our systems should know that if you've had it cancelled, we need to find you accommodation for a week and look after that child. We see children on oxygen, we see men, you see people in hotels with oxygen cylinders. We've never seen this level of healthcare in the community that we can't meet before. Like, it's all been growing. Like, we've had a nurse since 2006, thanks to the MANA. And then we've got funding through the PHMs for the night nurses. And they've demonstrated that the value for money is huge, that it stops people going up to ED. It stops, but we don't have the money to do the follow through.
Yes.
And a lot of people need medication managed every day. Like, people are in, I think we've had 6 people in palliative care with the nurses recently. You were talking before about the 4 deaths. Healthcare and homelessness now are just so intricately linked. It's
Well, I was going to ask about that, and I know Andrew from The Guardian has been talking about, and he said that you had mentioned to him that you have a program for palliative care.
Well, we haven't. We have an idea.
Right.
We just need a few million.
Okay. Because there is a growing number.
There's models around that are very cost effective. Unfortunately, you'd need the capital to have something that everyone would have their own, like an old retirement village or something. We
But how
almost
many-
came close, but
How many
it's-
homeless are you supporting that are like that have cancer and that are?
well, at the moment, we've only got the capacity to probably support up to 20, but there's more than that. But yeah, there's a huge need for that. And we've seen some great models of Western Australia has funded respite care, they call it. Other places call it recuperation centres, others includes palliative care. So there are models, and they're very cost effective, and people die with dignity. One of the things at Common Ground when the first year we were there was not everybody got well by being housed. There were several deaths, but at least people were dying with dignity, and
Exactly.
that's what we should aspire to for everyone in our
That's what I
community.
say. Anyone that dies in a tent or out on the street is a failure of our society that just shouldn't happen. So, I was going to ask another question. Have you got a question while I'm thinking of my question?
I have. I guess if you had, if money wasn't an object, or like where should we be heading? Like if you had money, obviously building the houses, and then that might fix the issue we've got at the moment with the numbers we've got. But then we're gonna have all these other new numbers coming up as well, so we almost need to build like double.
You've certainly got to, yeah, you do have to plan that for every person coming through, you probably need two or three permanent houses. However, I think you find there's a lot of people we see where there's a cycle. They go in and then that's out, and then they're in and they're out because there hasn't been support. If we could fix it for the most vulnerable, then we can work out what to do for the people that aren't as complicated, like the systems that you've got to bring together may not be as complicated. It's not the people that are complicated, it's how you get these systems working together. So, you know, I think I would certainly put money into community-based healthcare and supportive housing where the services are on site, and get the people that have been longest homeless off the streets, even people that are falling into homelessness who are very vulnerable, you know, like disability, because that's happening all the time. And then we can also work at the same time at prevention. I mean, the biggest prevention is affordability, because it's never been as bad now as it is now in terms of people's income not matching the rent.
We've got people, 60-70% of their income is rent.
Yeah, and we've got, it's a whole population of people. It's not just older women or older men or families, or it's a population issue from birth to death and everything that happens in between. So every community needs to really look at it, know people by name, understand who they are, how long they've been there, what's the particular support system that this group of people are going to need, and start with the hardest, because then it gets easier. Whereas we often leave the hardest and say,
let's solve
let's
the
solve
easier
the
ones.
easier ones.
Yeah.
Not that homelessness is easy for anybody. And the longer people are in it though, the harder it is for them to come out as well. So that you need those systems that, so I don't know, I'd create a system.
So how am I
plan
not,
it, you should get, you know, Moreton Bay should plan it, Brisbane should plan it.
how am I not going to go home and just cry, or go to the park and just cry tonight, feeling like
I'm sure you face that every day, Paul,
but is there any good news? Kind of like,
well, every person that gets housed is good news. That's why we keep track of it. Like when we can at least look back and say, despite all these challenges, 2,000 people have been housed collectively by 15 organisations, or, you know, in a period of time. Having that data, understanding that's what keeps us hopeful. And constantly learning. There's no easy fix. Like there are multiple solutions. Governments are very fond of cookie cutter solutions, that what you do here, you then go and do in every community. We've really got to get communities working it out together. And I think, you know, your supporters show that so many community, and we've experienced this over the years too, there is so much interest in the community. And how do we galvanise that interest to make, because not everything can be professionals.
yeah.
Like
So what can our supporters do to help lessen the impact?
Well, I think what you're doing, you're clearly showing that a sense of community matters, and being seen matters. You're not solving the problem of homelessness every day, but people are being seen, and you're making people visible. And, you know, I hear it as much as you hear it. People feel invisible. They feel that nobody cares, nobody wants them. They're just a nuisance and they should go and kill themselves. We hear that all the time. We never used to hear that as much as we hear. And even the mental health data now is showing that housing stress is contributing to significant mental illness. So, you know, all the pointers are there. It's not. So I think just doing things that we know work and keep doing them, keep trying to be creative. Like, what are some creative ways that, I mean, what you did down there at Redcliffe by putting all the bins in the toilet, like, that's creative. You know, we know what you need to do to solve, not managed encampments, not solve it, but we know that a coordinated approach, if encampments happen, that we have to all play our role. And we know that that's the best way to do it. But, you know, we also need a pathway to housing.
And
like, there's not just a magic.
without putting you on the spot here, do you think both Moreton Bay Council, Brisbane City Council, and councils Australia-wide could and should be doing more.
Absolutely, there's no solution to homelessness without councils being a lead role. Like everywhere, every community that are grappling with it, the local councils play a vital role, usually in coordination, putting some money into where it seems to be needed most, but also making sure they're actively trying to deal with those barriers around planning, and making sure that we're not just building for the rich.
Yeah.
Gentrification has its own challenges, and the best way to get around that is by saying, well, we are going to have a mix of people here. Like, we can't just say, well, we don't want these people here anymore, but we've got to do it properly so everyone's safe. We have to be realistic about the challenges of some of the people we support. While the mental health system's in the state that it's in, that's very hard. Like, there's a lot more risk these days, and to violence breaking out when people are off their meds and stuff like that.
Mm.
The trauma that prison presents for people when they're coming out and how that might unfold. Those things are solvable if you can spend time with people and do it, but it's not easy. And but we can't just ignore it and say it's a criminal offence.
I've had some people on YouTube, someone said, I've got to put some of the questions that are on YouTube because I've been doing just Facebook. The government is not going to help anyone. I think we simply need to activate our communities and personal humanity. We each need to act, help, and give where we can, like the boys do.
I think governments are doing things. I think it's wrong to say governments aren't doing things. I think it's unfortunate that it's become such a either ALP or Liberal, or it's an ALP crisis or it's a Liberal crisis. It's a crisis. I think that we've got to work together. There are different governments all over Australia, so no one has solved it. And it's an economic issue, and it's one where you've got to actually say community matters. Like, there is no market for this. When people sit there and say, oh, the market will provide, that's rubbish. The market, there isn't. These are people, they're not a market.
Yeah.
So it's really about valuing community and investing in community, no matter what, whether you're ALP, Green or Liberal.
I saw council, this is Yvonne, I saw council put up 30 temporary dongers. They were all fitted out, it cost huge. They did it over 2 days for a sports event. Why not the homeless? It seems so wrong, even corrupt.
Yeah, I think those models are well worth looking at. I know Melbourne's got a great little community of tiny homes on land that was reclaimed. What I find frustrating is so hard to get the facts from anyone about whether there is land we could do this on in Brisbane. Is there? What would it take? And you've got to be realistic. Like, you can't just go and renovate something that's falling down and then say it's transitional and we've got to keep it. You've got to do something that's sustainable.
I guess too, like if you were to put up dongers on land, you'd have to have
all the facilities.
You'd have to have the facilities, but you'd also have to have different areas. You might have some women experienced DV, and you obviously wouldn't want to put them with people.
We wouldn't want them in a donger to begin with.
No,
because they might need to be somewhere safer.
Yes, yeah, but I'm talking about different demographics of people. It's not
I
going
get
to be. You
asked
couldn't put
1,000
everyone in
times
the
why
same
wasn't
area.
Pinkenbar.
Yeah.
I mean, Pinkenbar was not near any essential services. If you went there, it was built as a quarantine centre. It didn't even have laundries. It didn't have the facilities that you needed. If anyone wanted to put the money into it, that was a different question, but we never got to that point. So, I think we can't just keep going from because you're homeless, you just deserve a donger either. That's the other thing.
Yeah.
Like, you need things that might be temporary, but make sure they're temporary so that we're building something that's
on top of what we're already doing.
Yeah.
Someone said, I think people with lived experience are important to understand and build relationships. I think Micah has a lot of lived experience staff and stuff like that.
I hope we listen to people. People are trying their best, and we've spent time having forums in parks and stuff like that over the years. People are sick of telling us what they want. They want a house.
They want us to actually,
Like, it's not actually rocket science what they want.
Yeah.
But of course, we should involve people and talk to people about it.
Yeah, cool. That's all the questions.
Yeah, awesome.
I think we've bent your ear for almost an hour now.
Yes.
So grateful
thank
for
you.
your insight, Karyn.
Yeah, thank you. It was really good.
You are a wealth of information, and
Oh, sorry, I do have one more question. So, and this is from my own knowledge. So is Micah like the in-circle equivalent? Are they? Are you pretty much doing the same thing? And is there a boundary line between Micah services and where in-circle starts? And in-circle will only look after a particular area, and
Every organisation looks at their boundaries differently, I suppose. We're in our service contracts, we're told what our boundaries are. Brisbane, you can't work just within those boundaries because as houses come up, they won't necessarily be in that. So we don't drop people.
right.
As we're the only 24/7 service for a while, we would go anywhere. Like we have spent time at Moreton, plenty of times before you guys were probably there. You know, I think you go by what the person needs and how urgent that need is. And if I've got the capacity, we will do it. If we don't, we'll tell people and say we'll find someone to do it, or, you know, sometimes they miss out. But it's not because of boundaries. For us, it wouldn't be just that. It would be, have we got the capacity to go? And if it, you know, at night, sometimes you do have the capacity.
well, Bo's going to be giving you a call then.
Yeah, bet you do. I mean,
I don't have too much luck with.
I don't know
other
what
services.
the outreach services are at night at Moreton. Have they got any?
Apparently they do.
Yeah.
I
I think that there's a lot of we've got to
No
do
comment.
a lot more work about coordinating what we're doing because it's relatively new funding. I mean, look, we're very lucky. We've had outreach services for 30 years, so we've been building up to having a 24/7 service. We knew exactly what the gaps were. We knew what we'd do the minute we got the money, but other communities may not have had that because it was just decided, you know, outreach money will go to everyone. And not everyone was as prepared. We were really lucky that we've had that gradual. We knew what the gaps were. We knew what we would do at night, and we've been doing it. And we think it's great that there's a 24/7 service
yeah.
for domestic violence and homelessness.
I guess you know, for me, when someone comes and they approaches me and say, "Hey, Bo, I've just become homeless. What should I do?"
Well, you go
and
to your
then,
local services. Is what, yeah.
And I feel like I'm just palm-balling them off to a service that I know is already bottlenecked.
Well, we're bottlenecked at times. Like the system at the moment isn't a system. You know, it's. I think we're all coming through. I feel like we're getting ahead above water a tiny bit since. Sorry to say it, there were 90-10 Super Park, which just was like you know, that created enormous work in the suburb. And it was politicised a bit, which made it even more stressful. So I think we're just coming through that a bit, and I think this how we do work across regions is something that at different times of the day, or how we complement each other across regions, is something that probably will, you know, be looked at now. Because we know the housing isn't just going to be like the motels just aren't in Moreton, they're in Brisbane.
Yeah.
Like it's an artificial, it's like the river. For ages in Brisbane, the river has been the driver to what service people get. Whereas we just want to, we're all coordinating a lot more and complementing each other a lot more.
Well, I want to say thank you to you and Micah for the ongoing support that you give the people that we do help. You know, we've got Scott in a hotel and a nurse, a Micah nurse is visiting him every day. He's going to be a long-term project, but
Yeah, it's just luck and persistence sometimes. Like,
exactly.
we can have 10 people talk to someone, you never know when the one who's going to be successful.
Exactly.
Anyway,
And
enjoy the
then we
rest
all
of
work
your
as a
night.
team. Yeah, thank you, Karyn.
I'm not going to do it, that's for sure.
Yeah.
You want to come and hang out with us at Musgrave?
No,
okay.
I'm ready for bed now.
Yeah, awesome. Thank you so much, Karyn. Yeah,
Yep.
we'll do it. Thanks.
Awesome. And thanks for watching, everyone. Paul and I are heading off to Musgrave.